Hi, I'm Dr. Plemon from Zehr Chiropractic in Norton Shores, Michigan. When I'm sitting down and talking with a new patient, they'll often say they really wanted to come try this out, but they're always afraid that once they started, they'd have to keep coming back. Or you'll hear someone say, chiropractors, they always make you keep coming back. And my first instinct is to kind of chuckle. And I'll say, okay, open up your medicine cabinet and look at some of your prescription meds. Did your doctor ever tell you, yeah, just take those blood pressure meds for a few weeks and then we'll taper you down? No, you're taking them multiple times per day for the rest of your life. And why do you do that? To maintain your health, right? I don't want to see you twice a day for the rest of your life, and you don't want to see me that often. But the point stands that if you want to maintain something, it does take some work. You don't go lose 30 pounds in the gym and then say, I'm good, and then go back to what you were doing. Guess what? You're going to put the weight back on and you're going to lose all the gains you got in the weight room. It's just a fact of life. And our average patient that walks in here has had their condition at least 2 years. And often that's just the symptoms. It was festering there for years and years before. So, we're up against things like chronic inflammation, muscle imbalance, postural changes, muscle memory, altered movement patterns. All those things are fighting against us. We're not catching our patients within 2 or 3 days of the problem starting, not very often anyway. If we were able to get to everyone right when it started, we wouldn't have to take as much time to fix them. That said, most of our patients start noticing changes within the first couple of weeks of care. But, obviously, once we get the results we're trying to get, we try and figure out that minimal effective dose just often enough to maintain. And that's different for everybody. I have patients that can go a couple months. I have patients that have held their atlas for 6 months at a time. I wish I could. Obviously, everyone's different. And some people, they want to make the commitment, and once they feel better and they get back to doing the things they want to do, they want to maintain it. Cool, let's do it. And if they don't want to do that once they get well, they just want to, treat this like chiropractic aspirin and just come in when it hurts, that's their option, but they generally don't do as well because they're not maintaining it. It'd be like with your car, just only taking it to mechanic once you start getting, check engine lights. Obviously, you still want to rotate the tires and check the oil and treat your car the way you want to treat it if you think it's going to last you a while. Well, guess what? You cannot trade your body in for a new body. You certainly can't trade your spine in. Not yet anyway. So in the meantime, I think it's a good idea to maintain. And that's easy for me to say, but hey, I do it myself. I get adjusted every other week by Dr. Zehr, and I check him as well because we got to stay on our feet so we can take care of our patients. And not to mention, I got to be home, going home and being productive on the weekends. So I maintain my spine just like I expect my patients to do the same thing. I do my spinal exercises I need to do. I do my stretching. I get out and walk a lot. I exercise. And I'm not saying that to brag. I'm saying that I'm not Wolverine. I have to maintain my spine just like I expect my patients to do. I wouldn't ask you to do anything that I wouldn't be willing to do myself. So think of the big picture when you're thinking about, how you take care of your spine and your health. It should be just like your teeth or your vision, anything else. You don't just show up to an optometrist one time and then never go back again. You maintain. Chiropractic should be no different.